So the good thing about this placement was before we even started, we had a one-to-one meeting with Maggie, who is one of the clinical leads. So that meeting really reassured me and made me feel comfortable with where I was going to be having my placement.
So when I found out I was in general practice for my management placement, I was a little bit concerned because I was studying mental health. However, I met Maggie for a drink before we started placement. We had a nice coffee, and my worries kind of disappeared. I knew from that moment that, you know, I was going to get loads out of the placement.
To be honest, when I found out I was in a GP surgery, I did think that I'd be sitting behind a desk. I didn't think that I'd be able to do anything to do with mental health. I thought this isn't going to be beneficial for my last placement because I'm third year and it's meant to be a management placement. I didn't think that I would be supported.
I was very nervous to do my placement, but I did get a lot of support from my mentors, and so the placement did end up going smoothly.
So when I first initially found out that I was going to be working in the GP surgery for my management placement, I was really excited. I was excited to see what the role of a practice nurse entailed, as it was something I was quite interested in.
I feel it really helped me to improve my clinical skills, which is something I was quite worried about. As in university, you don't really get much experience with clinical skills.
The placement wasn't what I thought it was going to be. I don't really know what I thought about primary care until I actually went on the placement. I really hadn't thought much about it at all. But when I actually started the placement, I completely fell in love with it, to the point where my future plans completely changed.
It's brought me out of my comfort zone and it's really pushed me with my confidence.
I was met with my assessor, who'd done a really thorough induction. We had our initial interview, and we were able to chat about what I wanted to develop on my final placement, as well as, you know, skills and any other requirements that I really needed.
I had the opportunity to run my own clinics, doing the learning disability annual reviews, and this greatly built my confidence when it came to interacting with patients.
I had the opportunity to work with doctors, physician associates, healthcare assistants and advanced nurse practitioners.
Training up, to be honest, we have sessions every Thursday with Maki, where she invites different professionals to come in and speak to us about maybe things that we, for example, they could call in a mental health nurse today. We'll speak about the different medication used in mental health. Then tomorrow they'll bring in a dietitian.
The training hub on a Thursday was just amazing. It got us all together. It was great. It gave us an opportunity to reflect on the week. It was like a chat, give you the chance to make friends, and also we had different people coming in to learn about different things. The learning opportunities in the training hub were amazing.
Our weekly Thursday sessions were also really helpful in learning different skills in different things, such as sexual health, child bereavement, mental health, and all these can be transferable to the GP practice. So that was really helpful.
It's a chance for you to socialize with your peers. So all the 3 years that I've been in uni, I hardly made any friends, I hardly spoke to anyone. But these sessions helped to bring me and my fellow students together. We're engaging more, we even created a group chat. It became more of a friendship where we support each other, and even outside placement, if someone is struggling, I found it was really good in the supporting each other's side of things.
I actually got to speak to students who were on our course and students who weren't on my course specifically, but on adults or learning disability. And throughout the whole 3 years, I don't feel like very many people talk to each other.
Overall, it was a great experience, and I would definitely do it again.
And this has been probably the most supported I've felt throughout the whole of the 3 years.
I just wanted to take this opportunity as well just to say a massive thank you. It's really opened my eyes to primary care and what it's about, and I'm really grateful for it, so thank you. Thank you. Bye.
I feel like this placement has really opened us all up to actually speak to each other, and I think we've made friends for life now.